Section27, which is an organization whose name comes from the Constitution. We are very lucky to have a Bill of Rights. So we have a constitution with a Bill of Rights, and the rights contained in the Constitution are what we call justiciable, which means you can actually go to a court to complain about conduct that violates your rights and get some form of redress or compensation. So we operate in a constitutional democracy, and our role is to play a part in civil society in South Africa. And we also work very closely with global allies in the UK, in the US, in India, really all over the world. And I think it's really important in your activism to think about the global context and think about what's happening in different parts of the world and see what you can do in a relatively privileged position to help people around the world. And part of what we're doing today is talking about access to medicines in COVID, and in particular talking about vaccines, and also Nick and I will talk about some of the history of the HIV movement in South Africa, if there are questions on that. So I would like to start just by saying that South Africa is a country in Africa that has been one of the most affected by COVID-19. So we've had over 50,000 deaths since last year. So that's a very high number in comparison with other African countries. And whilst we have got some vaccines, we haven't really been able to vaccinate any more than a few 100,000 healthcare workers. And what we know right now in the global context is that about 84% of vaccines have gone to wealthier countries. And that basically means the UK, the US, Australia, Canada, and Europe. So, the majority of the world actually has been either without a single dose of vaccine or with very few vaccines. We can talk more about the COVAX mechanism, which is essentially a pooling mechanism that was started by the World Health Organization to try and get as many vaccines as possible into developing countries. Because those are the countries which wouldn't be able to negotiate directly with AstraZeneca or any of the pharmaceutical companies to get the millions of doses that they need. So we're still looking at very few people who have been vaccinated. And the WHO thinks that the whole world will only be vaccinated by around 2024. At the pace that we're going, and given the context that we have right now, which is that the rich countries, including the UK, are really hoarding vaccines to the exclusion of other countries and people who are really vulnerable. So healthcare workers, for example, in many countries don't even have decent PPE to protect them, and they will go without a vaccine. Potentially until 2024. And we have the elderly in different countries. We have people with comorbidities. And those comorbidities that have been directly linked to poor outcomes with COVID include things like diabetes, tuberculosis, which is a respiratory disease, and these are heavily prevalent in developing countries. So these are poor people's diseases, and these are the very people who are excluded from getting vaccines because of the system that we have, but in particular because of the conduct of governments like that in the UK and in Europe and in the US. And so what we're doing as activists is to tell the story and talk about what the impact has been. In South Africa, for example, there was a huge shedding of jobs. Millions of jobs were lost very early in the lockdown because we had a lockdown from March 2020, and we're still in a looser lockdown, but still in lockdown. So a lot of the jobs that have been lost were lost by women. And in South Africa, women look after children. So we're seeing that there have been increases in hunger around the country, but in particular increases in child hunger. So you can imagine if you are in a family where a parent has to decide who gets food that night, if anyone is able to get food. And that's because a lot of people operate in what we call the informal economy, which means they don't have access to any kind of social security, or they can't be furloughed because there's nobody to pay them whilst they're not working. They work in very informal, insecure jobs. So if they're not at work, they don't get paid, and they often don't have access to any other social security. Remember, there are also undocumented people who would not have access to any kind of support. So we've seen that, high levels of hunger, high levels of unemployment, and of course the socioeconomic impacts are things like increase in mental health stress, which is one of the things that was researched to find out that a lot of people in South Africa were now suffering from mental health conditions due directly to the insecurity caused by the pandemic. So there are very real consequences of shutting down economies, particularly where there's no or very small safety nets. And the way to address it is to address vaccine nationalism, and put in place mechanisms, even if they're temporary mechanisms, that would allow countries to access vaccines. We've also been arguing that there's plenty of manufacturing capacity around the world. There are many pharmaceutical companies that are not actually producing vaccines that could produce vaccines if they had the technology and know-how to be able to do so. So there are, one company called Gilead is one of the major vaccine manufacturers in the world, but it doesn't have a COVID vaccine. And so they would be able to convert their factories to produce COVID vaccines. And the reason why there's such a resistance to opening up knowledge and know-how and opening up the recipes, as we say, to make COVID vaccines, is that even though this is an extraordinary situation where we have 1 in 100 year pandemic, we will see what it's like to have a different system, to have a system that considers people, that considers lives, and puts aside the notion that high profits are required in this industry. And this industry is very highly profitable. So there's a lot to lose from these pharmaceutical companies. And that's why there's such a resistance. Our government, the South African government, together with India, proposed a mechanism at the World Trade Organization to actually set aside intellectual property rights for a temporary period, so that countries are able to just import whatever vaccines, are able to manufacture. We've said there has to be greater manufacturing. That's the only way to get vaccines, the numbers of vaccines that we need. There's really a dearth of vaccines in the world, but that we say can be addressed by sharing the technology with different companies and increasing manufacturing to a very high scale. So that's where we are now, and that's what we've been fighting for. I'll hand over back to Heidi, and if there are any questions, I'd be happy to talk more about any of these issues. Thanks.
Thanks so much, Umunyana. That was brilliant, really, really informative. Thank you. So I'll pass over to Nick now. Are you ready, Nick?
Yeah, sounds not so good. It was fine earlier.
Oh, there we are.
Yeah.
Is that better? You can hear me now? Great. Okay, thanks very much. And such a pleasure to speak after Umunyana, because one of the things that really inspired me when I was in my 20s was South African activists who were fighting against what I see as one of the most obscene examples of how the global economy works. In the late 90s, early 2000s, HIV/AIDS was allowed to rip through Southern Africa, affecting millions of people. Even though we had the medicines to stop it, we'd created the medicines that could have put a halt to that spread and could have made people's lives much, much more manageable. Why? Because profit and the rule of the market trumps everything in our current economy. And millions of lives across Africa were as of nothing compared to the supposed right of big corporations to charge whatever they like for life-saving drugs. But it wasn't just a tale of suffering and victims. What really inspired me was there was such a strong response, particularly from people suffering with HIV and AIDS in South Africa, who put forward just the most amazing, creative and militant challenge to this inhumane system, who stood up and showed people like me that you can take on some of the biggest corporations in the world and win. And we did have real victories at that time, but sadly, the system of corporate monopolies and profiteering off our health is still very much in place around the world. And of course, that's what we're fighting against today, because it's costing just as many lives now. Now, the facts are these. The public sector, funded by us, has created a huge amount of medical research, especially the most risky bits of medical research, especially for the most life-saving medicines. We then privatize that research. A transnational corporation goes off and produces medicines that are monopolized for 2 decades as an absolute minimum, during which they charge whatever the market can bear for those medicines. They prevent any competition. They refuse to share their know-how with anyone else. And throughout this, we still hand massive subsidies over to these corporations through the National Health Service, buying up these medicines, trialing medicines, distributing medicines. And all of this is held in place at a global level by a set of trade rules called TRIPS agreement, that was essentially written by Pfizer and friends in the mid-90s, which imposes their monopoly power on the whole world. And by the way, also renders the whole pharmaceutical sector unfit for purpose. Well, depending on what you see the purpose of the pharmaceutical sector as being. If you see it as a sector that should be creating the medicines we all need for decent lives, then it does very badly at that. If you see it as a way of extracting as much profit as possible for shareholders from the rest of society, they do that really well. It's made these corporations some of the most profitable entities on the planet. And far from investing that profit into new and useful research, they spend most of their funds on legal cases, on litigation to protect their monopolies, lobbying governments to give them ever greater powers, buying up companies that are doing the really cutting edge research so they can sit on their patents for 20 years or more, and developing medicines to treat but not cure chronic conditions suffered by middle-class people in the world, because that's a good source of continual income for them. And meanwhile, our medical system is collapsing around us. So antibiotics are increasingly ineffective because they've been overprescribed, but also because these pharmaceutical corporations see no profit, no decent return on investing in researching new antibiotics. And antibiotics are a bedrock of our whole medical system, without which basic operations won't be possible anymore, and diseases that are very curable at the moment could become life-threatening. So the big pharmaceutical system does not work to produce the new and innovative medicines that we all need for a healthy life. And it's really symptomatic of the way the whole global economy works. The whole global economy aims at extracting wealth from people and the planet, the environment, in order to make some very, very rich. And by the way, it's this system of monopoly capitalism, which isn't just a problem for our healthcare, it's also encouraging industrial agriculture, where a handful of corporations control our entire food supply around the world. It's given unprecedented powers to a handful of big tech corporations, Google, Facebook, Amazon, who now have dangerous levels of power over our societies and over our lives. And it will make sharing the technology that's necessary to halt climate change impossible too. So we've got to tackle this corporate power. We've got to tackle this global trade system that allows this extraction of public value for the benefit of enriching the very few. In the coronavirus pandemic over the last 12 months, transnational corporations have taken massive public subsidies. They privatized public research, and they are then in charge of who gets what, essentially of who lives and who dies. And as we know, what they've decided to do is mostly sell their vaccines to rich countries, creating the most obscene global divide in who has access to these life-saving medicines and who doesn't. And they're walking off at the same time, in some cases, with an immense fortune. So Pfizer, which was given $6 billion by the US government just over the last year, expects to make $30 billion in sales this year of coronavirus vaccines. Moderna, which is produced another vaccine, almost entirely with public money. Its corporate executives have made hundreds of millions of dollars this year, selling their shares as the share price has rocketed. Some have said they won't sell at profit this year. That's a start, but still, they will hold on to those monopolies for 20 years, and they will make profits over the long run. Meanwhile, most of the world has no access to vaccines. Meanwhile, there are factories around the world that are saying we could produce, as Umunyana said, we could produce these vaccines if you just gave us the technical know-how and surrendered your property rights, and they won't. And when India and South Africa came to the WTO and argued for a suspension of monopolies so that we can all produce as much as possible, the governments, like the British government that have bought all the vaccines to date, said to them, no, don't worry about it. It's all going to be fine. The system will provide in the end. The market will provide in the end, which is, of course, complete nonsense. There's one positive out of all this, and that's that I think it's been a huge wake-up call to many people around the world, because opinion poll after opinion poll suggests that the vast majority of people in our society, wherever they are on the political spectrum, thinks this completely stinks. And that's why I've got real hope that we can challenge and defeat this system this time. We've been working on this for years. Campaigners all around the world have. We're all part of something called the People's Health Movement, which is a really strong network that's been opposing these rules and these monopolies for a long time now. But all of a sudden, it's front page news. Even President Biden is reported to be considering suspending TRIPS and suspending intellectual property, pushed hard, of course, by Bernie Sanders and left-wing activists within the Democrats. A few days ago, a Brazilian court made a ruling to limit monopolies, and dozens of countries have given themselves the power to override monopolies when it becomes necessary. We argue it already is necessary now. So this is really the time to push this. Get involved in this campaign. We've got days of action coming up. We're planning a People's Assembly. We've got creative action, direct action, protests. If you want to have meetings on your campus or in your local area, do ask for speakers, and we can help sort that out, because this is absolutely huge. We're taking on something here, as I say, that's been an injustice for decades. And there are moments when we've pushed it back. There are moments when we've achieved exemptions and loopholes, but this could be a time where we could really fundamentally change how this inhumane system works, to end the suffering and death that it's caused for so long, and to begin to build something which is really fit for human beings in the 21st century. So thanks for being here, and thanks for being part of this.
Great, thank you so much, Nick. That was really good and really informative, and I'm glad to hear there's a bit of hope as well. So I've got some questions, and then we will open it out to other people. So if you do have questions, you can pop them in the chat, or there will be a little bit of time at the end for you to pop up your hands as well and ask your questions out loud if you'd like to do that. So these questions are to both of you, and you can decide between you who replies or share the response if you'd like to. So first of all, I think you briefly touched on this, Nick, but AstraZeneca say that they'll produce their vaccines at cost price during the pandemic, and this sounds like a good thing, but I just wondered whether you could say whether it is a good thing or not. Or
I mean, in as far as it goes, it's a good thing, of course. But you know, that vaccine was made with public funding at Oxford University. I mean, I call it the Oxford vaccine because that's where it was made, at a public institution with public money. And the researchers who made that vaccine always said they wanted it to be a people's vaccine without patents and monopoly rights. And then AstraZeneca came in with the help of the Gates Foundation, and they privatized it. You know, they made it private property. And of course, it's good that they're not making a profit on that. But there's a lot of problems in terms of the transparency of the contracts that they've signed. We know that just from the fight between the UK and the EU. And we know it also because we've seen South Africa paying more than double for AstraZeneca doses what Europe has paid. So we don't know how that's the case, but part of the problem of secrecy in this industry. But more generally, they will make a profit after the pandemic is over from selling to most of the world. And we believe that's just wrong. This should be a people's vaccine. We should be allowing factories all around the world to produce this. It shouldn't be about somebody's property and somebody's profits. So sure, they're better than Pfizer, if you like, but it is not the system that we should be fighting for.
Okay, thank you. Umunyana, do you have anything to add to that one?
I think I would just add that, you know, there's an opportunity to challenge business as usual. And I think that if AstraZeneca actually does this, then we have an example of a different kind of model. And we often hear as a response to our demands that, oh, well, what else is there other than this very profit-driven approach. And we say, well, there are, there are alternatives. And actually COVID has provided this alternative, which is massive public funding into research, into manufacturing, into procurement deals to ensure that companies are actually able to do the production because they have guaranteed procurement. And we've seen that actually this is a different model. And if we see nonprofit vaccines